My goal today is to talk to you about some general concepts about heart health and keeping your heart healthy. I'm going to tell you a few things that you probably know already when we talk about heart disease, especially if it's somebody in your own family or yourself personally have suffered from it. And that is that it's still the leading cause of death, not only in the U.S., but in the entire Western world. Over 500,000 or about 600,000 people die from heart disease every year, both men and women. Since 1900 here, it's been the leading cause of death every year except for 1918 when influenza kind of beat us out. But since then, we've regained the top spot ever since then. So again, it just reemphasizes that it's so prevalent and so predominant that everybody here has either had it themselves or knows somebody very well that has suffered from it from one form or another. Every 34 seconds, someone in America dies from a heart attack or has a heart attack. If you look at it, 1 in 3 adults, and again, if you just look across the room today, 1 in 3 adults has had some form of cardiovascular disease during their lifetime. And among women, almost a third of women have some form of heart disease, or about 1 out of every 2.6 deaths among women are attributable to heart disease. Now, if you ask women what are they most concerned about, most of them will say breast cancer. And you know why? Breast cancer obviously is predominant up there with it, but it means that the people that treat breast cancer have done such a good job of educating women on breast disease, and we've probably not done as good a job as we have. Because if you ask women, are you worried about heart disease? Most of them say, yeah, absolutely, I'm worried my husband's going to get it. And what a lot of people don't realize is that women suffer from heart disease in almost the same numbers that men suffer from heart disease. And I always tell you, if you don't take care of yourself, you won't be around to take care of your husband. And most of your husbands won't do very well if you're not around, at least from what I've seen in my own practice. So it's incumbent upon you to take care of yourself if you're going to take care of the men in your life. This is just a chart to show you what you already know, and it's what I tell my people in my office every day. We don't treat 25-year-old swimsuit models. And that is that heart disease affects all of us as we get older in life. And by the time you get into your 50s, 60s, 70s, and certainly in your 80s, the prevalence of heart disease, not surprisingly, goes up. And that's predominantly due to the fact that most of the things that put us at risk for heart disease, whether it's high blood pressure, high cholesterol, diabetes, smoking, obesity, sedentary lifestyle, all of these things we're familiar with, are cumulative. And that is, they add up as we get older, and the cumulative effects of most of them don't reach us until we reach our 50s to up through our 80s or even our 90s in these days. Contrast with that with the fact that heart disease doesn't start. So if somebody comes in and they have a heart attack in their 70s, they didn't just develop heart disease in their 70s. Some autopsy studies were done back in the Vietnam era on servicemen who were dying in their 20s, and they showed evidence of early forms of heart disease even then. So when somebody has an event in their 60s, 70s, 80s, or beyond that, that event started way back in their 20s. And it usually starts with very mild atheroma or very mild plaques in their coronary arteries that build over time until they experience a clinical event. So this is something, and I always tell people this, the earlier you know about the risk factors, the earlier you know what kind of changes you can make based on what puts you at risk, the sooner you can do it and the sooner you can keep from having to see somebody like me as you get older. Don't worry, I don't mind seeing you, but if we can prevent something by starting preventative medicine early on, that's so much better than treating things after the horses are already out of the barn. Everybody's familiar with what we consider the traditional risk factors. We talked about them already: high blood pressure, high cholesterol, diabetes, smoking, genetics. And I'll talk a little bit about that in terms of family history and what we typically ask somebody, because they say, yeah, my grandmother had heart disease when she was 93. Well, if you live long enough, you're either going to get cancer or heart disease, because those are the two biggest killers. So what we generally mean are people that develop heart disease at what we consider a premature age or before the age of 60. So somebody that unexpectedly had an event, a heart attack or a stroke, had bypass surgery, had a stent when they were in their 50s or earlier than that, usually signals a family history or a genetic predisposition to it within their family line. Obesity obviously plays a role, physical inactivity, which ties into obesity and some other things that we'll talk about. And then alcohol, and I'll talk to you a little bit about alcohol, because there's a little bit of misinformation out there about how alcohol affects heart disease, both from a positive and from a negative standpoint. So let's take each one of these risk factors and let's kind of dig a little bit deeper and kind of open this up and talk about it, because people say, well, yeah, high blood pressure does, but why does high blood pressure have any effect on people? And in real simple terms, you know, when you go to the doctor's office, they measure your blood pressure. What we're really measuring is the pressure against your arteries based on your systolic and diastolic pressure. And why is that important? Well, when we're all young, when we're all, you know, teenagers in our early 20s, your arteries are nice, pliable, flexible. Basically, your arteries are a big conduit. They're a big highway system, like the interstate highway system here in America, that carry your blood all over your body, bring it all back to your heart again. As we get older and as we have high blood pressure and as we have some other risk factors, our arteries start to harden. People always hear the term hardening of the arteries. It really comes from the fact that these arteries, when they're exposed to high blood pressure for long periods of time, they start losing that elasticity, that flexibility, and they start narrowing and hardening down somewhat. They then lead to the things that we're all very familiar with, which are the clinical manifestations of that, primarily coronary artery disease, which is the most common clinical one. In very simple terms, if you're not familiar with it, coronary artery disease is simply where you develop blockages or narrowing in your arteries, specifically supplying blood to your heart. Clinically, what people come in with is chest pain, heart attacks, things like that. If it goes on too long, because of the fact that your heart's having to work against high blood pressure, it will cause your heart to enlarge or to thicken. And the analogy I tell my patients is, everybody's familiar with the bodybuilders. They go out and they lift weights all the time and their biceps get big and thick. Well, if your heart pumps against high blood pressure for years and years, your heart gets big and thick. It looks real good on your biceps. It's real bad on your heart. And so that's how it affects enlargement of the heart. If that process continues to where your heart has to do an undue amount of work for years and years against high blood pressure, your heart eventually will wear out or your heart will start to weaken. So you'll go from being an 8-cylinder engine to a 4-cylinder engine because your heart simply can't handle the load of working against that. As most of you know, high blood pressure for most people is completely asymptomatic. People don't know they have high blood pressure unless they happen to go to the doctor to check something else. That's why even if you go to an orthopedic surgeon who knows absolutely nothing about blood pressure, they'll check your blood pressure. Because that's the only time a lot of people get their blood pressure checked is when they show up for a cold or for some other reason. And I always tell people the worst way to find out you have high blood pressure is when you come in with renal failure, kidney failure, a stroke, or a heart attack. So picking it up early when it's, for the most part, asymptomatic is the key to treating it. That makes treating it a little bit hard because you're taking a disease that doesn't give you any symptoms and you're saying you got to take medicine, and sometimes the medicine has side effects. Medicine costs money, it's inconvenient to take. So you're taking a disease state, high blood pressure, that at least when you first get it doesn't have any symptoms, and you're having to take medicine that may give you unpleasant symptoms. So you have to really explain to people why treating high blood pressure is a big deal, because the average person out there will say, well, you know, I feel fine. Now you're telling me I got to take medicines that cost money that make me feel lousy potentially, and I got to take them more than once a day. So it's incumbent upon us to do a good job of explaining, well, why when you're 30, if you've got high blood pressure, do you need to take medicines when it's not bothering you? Well, it's because I don't want to see you when you're 40, 50, and 60 with a heart attack, a stroke, or on dialysis. And so some of the time I think we don't do a great job of explaining, listen, I know it doesn't bother you now, but if you don't do something about it, when you hit that event where something happens, it's almost too late to do something about it and reverse time from that standpoint. So what can you do? The first thing I'm not going to put up there is take medicines for it, because that's not the first treatment. By the time most people get to me, they're on some type of medical therapy for high blood pressure. But when you talk about it, when you treat it early, especially when it's first diagnosed, the first thing is always going to be diet and exercise, and that ought to always be part of the plan. Keeping a healthy weight. People, I think, are a little misinformed, and I don't think understand a lot of times, though. I always ask people what did they weigh when they were 18 or 24, because that's usually what most people's goal or ideal weight is, and we all unfortunately tend to gain a little bit of weight as we get older. But if your heart is used to pumping blood, or God made it to pump blood through a 180-pound body, and now you weigh 280, that's excess work on your heart that tends to cause the development of high blood pressure. So maintaining somewhat of an ideal weight is key in terms of controlling your blood pressure. If you're above your ideal weight, you know, it's not rocket science. Trying to get back down to your ideal weight by healthy eating and by some reasonable exercise is the first course before going on medical therapy. Exercise, again, we're going to talk about that a little bit more, and I'm going to keep harping on that, but I'm going to tell you why at the end, and it's not just something that all the doctors tell you. I promise there's rationale behind it. And then medication when necessary. And the key in medication, and this is what I've preached for the last 23 years that I've been doing this, is if at all possible, medication ought to be once a day if you can take it once a day. It's got to have very low side effects, and especially in this day and age when there's so many generic medications out there, if you can provide something that's effective and generic and doesn't cost you an arm and a leg to take, because once you're on high blood pressure medicine, unless you make some fairly radical changes in your life, you're going to be on it to control your blood pressure for the duration, or until you go meet the good Lord. So it needs to have those components in it in order for people to be able to take it long term. All right, let's switch gears and talk a little bit about cholesterol. And again, cholesterol is not all bad. Unfortunately, in a Western diet, it's mostly bad. It's not all bad. Your body needs cholesterol. Some people take that to the extreme and say, well, if I'm supposed to have cholesterol, why is everybody trying to get me to lower it? Well, because the issue is because all of our body's cells contain cholesterol. It's part of what makes up our cell walls and all of the cells of our body. Unfortunately, in a Western diet, most people have excess cholesterol in there. And excess cholesterol, especially oxidized LDL, and we'll talk about LDL and HDL a little bit, the two brothers in cholesterol, the good twin and the bad twin, do different things. But one of the things that they do is they tend to, as these arteries are carrying blood back and forth, and if the arteries are supplying your own heart with blood, is they tend to block off or clog up these arteries. And as they do that, that's again what leads to heart attacks and strokes, depending on which arteries it does. Where does your cholesterol come from? There was a great commercial. Some of you are familiar with the cholesterol medicine Zetia. It was advertised several years ago all across the TV, and they did a great commercial, and they talked about where does your cholesterol come. They say, and they had a nice little old lady with a cherry pie, and they say, well, part of it comes from your Aunt Sue, and part of it comes from your Aunt Sue's cherry pie. And what they mean by that is part of it is the food that you eat. About a third of it is determined by what we eat and what we do, and about 2/3 of it, for better or for worse, is determined genetically. And if I got people to raise their hands, I could probably take some of the skinniest people out here who still have high cholesterol. I take care of people who are marathon runners and everything else who still have high cholesterol because genetically they're programmed to make excess cholesterol. And so you've got to look at not only diet and exercise in terms of treating those patients, but in people that have genetic predispositions to high cholesterol. They could run and they could eat lettuce and carrots all day long and their cholesterol would still be high because predominantly theirs is driven by their body making excess cholesterol. So what are the factors besides that? Obviously, I don't know what they provided y'all to eat today, but usually it's something that'll contribute to it, which from a business standpoint I appreciate, but from a health standpoint maybe not so much. And we'll get back to that again, because again, I don't think that you've got to be a total vegetarian or anything like that. That's not reasonable for most people, but it's the question of making healthy, intelligent lifestyle choices that you can live with in the long term. And so we're talking about modest changes. Family history, like we talked about before, a lot of it is genetically driven and runs in families. Excess weight, again, for every 10 pounds of excess weight, your cholesterol in general will go up, and that's simply because you've got more fat cells. As these fat cells break down and make fatty acids, a proportion of those are turned into LDL cholesterol and stay in your bloodstream. So excess weight's always a contributor. Physical inactivity, we'll talk about that again. Not only does physical inactivity lead to higher levels of LDL or bad cholesterol, but they lead to lower levels of HDL, which is good cholesterol. All right, so when we talk about cholesterol, so what are we talking about? Obviously, it's a big risk factor. I'll talk to you a little bit about what the numbers actually mean, and the numbers are different if you're a normal, quote-unquote, healthy person without heart disease versus someone who has heart disease, and we'll make that differentiation in just a moment. Having your cholesterol checked. Cholesterol and high blood pressure are similar to each other in the sense that they don't produce any symptoms. So if somebody can have a total cholesterol of 300 and they feel just as good as a person that's got a cholesterol of 100. So if you don't have your numbers checked, a lot of times people don't find out they've got a problem until the day they present with a heart attack or a stroke or they drop dead from one of those. Again, that's a lousy way to find out you got a problem. But the only way to find out a problem, just like having your blood pressure checked by someone, is to go in and have your cholesterol checked. If your cholesterol is normal, it probably doesn't need to be checked again for several years. But you don't find out that you've got these problems unless you go and have them checked, because they don't typically produce symptoms until they get in the end stages of it and produce problems within your organ systems. So what are the numbers? If you don't have heart disease, what we typically tell people is a total cholesterol of less than 200. We break that down into HDL, LDL, and triglycerides. I'm going to leave triglycerides out for right now just for the sake of brevity and talk about HDL and LDL. LDL is bad cholesterol. The way I tell people to remember it is, remember L for lethal because it's bad, and L for low because you want it to be low, as opposed to HDL, which is your good cholesterol. H for high, you want it to be high. So you want LDL to be low, HDL to be high. It's kind of nice the way they made that work out. It's easy for simple people like me to remember. Typically, the higher your HDL, the more protective it is, and we like to see people's LDLs up around 40 to 60 or higher because it produces a protective effect for their hearts, and I'll go into that in just a moment. LDLs, did I put that on there? Yeah, LDLs of less than 130. If you have heart disease, and all right, let me back up and not say heart disease. If you have any type of vascular disease, and that's heart disease, carotid artery blockages, peripheral vascular disease blockages in any of your arterial systems, we recommend an LDL of 100 or less. If you have significant heart disease or diabetic, the data has now shown that if we can get your LDL down to 70 or less, it decreases your event. So when you go to the doctor and they say, yeah, we want your LDL to be down this low, it's not that there's something magic in that, but what we've shown is that by lowering your LDL through diet, exercise, some of the statin medications that we talk about and so forth, it doesn't just lower a blood test, it correlates to a decrease in heart attacks and strokes. And as I tell people again, nobody's ever come into my office in the last 2 decades and said, you know, doc, I feel terrible, man. My LDL must be through the roof. But they all come in and they say, you know what, I don't want to have a heart attack, I don't want to have a stroke, and I don't want to drop dead. Do you have something that will help me along those lines? And that's what these things do in terms of dietary interventions, exercise, and then certain medications that lower your LDL, and not just lower it, but we've shown through numerous clinical trials over the last 30 years, decrease your chances of heart attacks and strokes. And so again, that's the message that people on my end of the table need to be talking to y'all about, and that's not just lowering your LDL, but what that does in terms of lowering your risk of heart attack and stroke and sudden death. Talk a little bit about low HDL. Low HDL is a risk factor for heart disease, just like high LDL is. And the way that that works, let me kind of walk you through it a little bit. What HDL does is what people call good cholesterol, and it's bad cholesterol, or LDL, is basically what gets packed into your arteries, blocks them off, leads to heart attacks and strokes predominantly. HDL actually goes out into the bloodstream, and it actually takes the LDL and pulls it back out of these plaques, or pulls it out of your bloodstreams and gets rid of it by bringing it back to the liver, where it's brought in and then it's eliminated from your body. So it's a sort of a negative transport system to pull it out of your body and get rid of it. So if you make that connection, then it makes sense that the higher your HDL is, the more protective. The higher the HDL, the more cars that go out and grab the bad cholesterol and get rid of it in terms of your body. So that's why high HDL is very protective. Low HDL levels, let me show you what they're associated with. And this will tell you. Basically, being overweight, smoking lowers HDL levels considerably. Physical inactivity or sedentary lifestyles do the same thing. And I know nobody here is like this, but probably everybody here knows somebody like this. And that is the sedentary guy that sits around, watches TV, smokes, has a few beers at night or on the weekend or whatever. Those are the setup for the low HDL type people. And the problem with low HDL is there's no medication like the statins, like the Crestors, Lipitors, Simvastatins, all the medicines that lower LDL. There's no pill out there to raise your HDL to protect you. So raising HDL is harder. It's hard work to do it, but we've shown that if people that have low HDLs, if you can raise their HDLs, you lower the risk of heart attack as much as somebody whose LDL you're able to lower. So what can you do? Fruits and vegetables, and I'm going to keep coming back to this over and over again because it really is, it's so incredibly important in terms of your long-term health, and I'll get into it a little bit more in just a minute. And I'm going to tell you some specific things, low-fat dairy products and stuff like that. It all goes back to basically healthy living. And you know, there's been a real turn over the last 10 years to going back to more local-based farming, organically based farming, fresh foods, probably a lot of the stuff that y'all grew up on, but that my generation didn't. You know, I'm the TV tray generation. You know, I grew up in the 70s, and my generation, you know, we were all eating these TV dinners that I never met anything else where it could be steaming hot on the outside and still frozen on the inside. But that's, you know, that's how we grew up. But everything's kind of coming back around as people realize the importance of organic farming, of non-pesticide foods, of fresh foods that are grown here. We're fortunate that we live in an area where you can go to a farm, 2 or 3 farmers markets within driving distance and get fresh vegetables, even meat and dairy products that are fresh and that are not shipped in, you know, from 4 or 5 states away. So big thing in terms of importance. Alcohol in moderation, and I'm going to come to that in just a minute, but it's actually been shown specifically for red wine. We talk about is there ways to raise HDL. The 2 biggest things, or the 3 biggest things that have been shown to raise HDL. If you smoke, don't smoke. Stopping smoking raises your HDL. Okay, so well, I don't smoke. The 2 other big things that have been shown to do it are exercise. Exercise raises HDL in almost everybody, and I'm talking about aerobic exercise, going out and walking, going and swimming, doing swim aerobics, anything like that, and red wine. And in red wine, the study that was done showed that 1 to 2 glasses of red wine raises HDL levels in people and offers a cardioprotective effect. Now that doesn't mean drinking a bottle of wine a night will raise it that much more. There's a J-shaped curve in terms of what's good and what's beneficial versus what's detrimental. So everything's got to be taken with a little bit of a grain of salt in that. And then again, maintaining a healthy weight. Okay. Let's talk about diabetes. Diabetes is the epidemic scourge of America. And I'm talking about type 2 diabetes. I'm not talking about type 1 diabetes or people that develop what we used to call juvenile onset diabetes, the little skinny diabetic people or whatever. I'm talking about diabetes that develops in most people as they get older, they're heavier, they're overweight, and they develop diabetes as part of the aging process from not taking good care of themselves. There's a genetic predisposition to it as well, but predominantly it's in people who are overweight or not maintaining their ideal weight. Most people have heard of what's called a hemoglobin A1C. You know, the hallmark of diabetes is your blood sugar is high. Well, your blood sugar can change over time. Hemoglobin A1C is like taking a 3-month snapshot of what your blood sugars have been run. So it's a blood test with a memory is what I like to tell people. And that is, when you look at it, a good blood sugar control is usually a hemoglobin A1C of 7 or less. Kind of in the middle is 7 to 8, and then above 8 is usually poor control. People will say, well, I'm not diabetic. What difference does that make? Well, if you look, and let me get to the next slide and I'll show you. There's a study that was done where they looked at people with what was called borderline diabetes or diet-controlled diabetes. They weren't on medication for it, and they measured their hemoglobin A1Cs. And even the people whose hemoglobin A1Cs were not elevated, they were just at the upper limits of normal, also had an increased risk of heart disease. So it's not a yes or a no, it's a linear thing, and that is the more poorly controlled prediabetes is, the more poorly controlled your diet is in terms of taking in simple sugars, carbohydrates, and stuff like that, the higher risk you are, even if you haven't been clinically diagnosed with diabetes. So again, it falls back to the whole diet and healthy choices that we all make day in and day out. Cigarette smoking, I'm not going to spend a lot of time on this because everybody basically knows that smoking is bad for you, but never in America has there been such a discorrelation between what's scientifically known and what's clinically practiced. In fact, all of my patients that smoke, every one of them try to quit smoking. Nobody's ever quit smoking from me preaching to them or beating up on them, so I don't preach to them and I don't beat up on them. I just tell them, hey, whatever I can do to help you, I'll help you, but as long as you're smoking, let's make sure we do everything we can with everything else. It's the most addictive thing in the world. And the way that it gets you is if you talk to most people start smoking when they're teenagers. Well, when you're a teenager, you're immortal. Nothing will ever happen to you. You know, you can stop trains, you can leap tall buildings, and everybody when they're a teenager says, you know, I'll stop smoking one day. Well, when one day gets here, they've smoked long enough that they can't quit. And then it becomes a stress reliever, it becomes a whole lot of other things, and it gets so ingrained into you from a mental and emotional standpoint that it makes it very, very difficult to quit. So, but if you look at what's going on and what we now know about smoking, what's been known for a long time about smoking, it's amazing that anybody would read this and continue to smoke. And it tells you not how terrible people are that they continue to smoke, but it tells you really how addictive it is. And that is, if you look, there's over 4,000 individual chemicals that have been found in cigarettes. 2 of those have been clearly shown to be poisonous. So if I took any of y'all and said, listen, I'm going to give you something to let you suck on it for a while, and it's got 200 different poisons in it and 4,000 different chemicals, but go ahead and have some, and nobody would do that. Okay? I mean, if you're going to try to kill yourself, a faster way to do it the exact same way is just to go suck on the end of a tailpipe every morning. It does the same thing as smoking, it just does it faster. It doesn't use up as much medical resources either. So if you think that you're smoking the cigarette and not the cigarette is smoking you, you got it completely backwards. So anyway, food for thought. The sermon is over. Okay, stop smoking. I'm going to leave it there. Smoking patches definitely help. They help if you put them across your mouth and you don't smoke mainly, but it's kind of like people say when the doctor says, I want you to take an aspirin. He said, really? He said, yeah, I want you to take an aspirin. Take it to the gym, take it out to run, take it out to the food fairs, take it everywhere with you. It works, but it works in conjunction with everything else that we do. All right, let's dig a little bit deeper and talk about some other things that are kind of near and dear to my heart, and that is healthy living and active lifestyles, because this is something that all of us can do. The problem is, it's kind of like smoking. We all know what the right thing to do is. It's real hard to do. I don't enjoy getting up in the morning and going running or going to the gym any more than any of y'all do. I promise you I don't. The only reason I do it is 2 things. One is, I think if you go to a fat cardiologist, that's the definition of a hypocrite. If I weigh 250 pounds and I try to tell you how to live healthy, you're going to, one of these days, one of you is going to say, you know, you big old fatso, how are you telling me how to live and you don't even practice what you preach yourself? So part of it's that, and part of it is my wife is a big health nut and she'd probably divorce me. So I got a lot of reasons to try to stay healthy. So what can you do in terms of that? The American Heart Association and the American College of Cardiology both recommend 30 to 60 minutes of some type of exercise, and they say most days of the week. We've actually done some fairly nice studies. These were done over at UT Southwestern in Dallas, where I trained years and years ago, looking at if you do as little as 4 days a week, 20 minutes, you gain a pretty significant cardiovascular benefit from that. Everybody can do 20 minutes of something 4 days a week, okay? And I'm going to show you a slide in a minute that'll kind of reinforce that. So you don't have to go to the gym for an hour. You don't have to be a bodybuilder. You know, you don't have to train for the Boston Marathon. If you make some reasonable, modest investments in your health, it pays dividends long term in terms of that. Okay, why? I mean, why does exercise help? Everybody talks about it, but you know, most of us are past the bikini and the Speedo stage in our life. So why are you exercising? It's not to look good and to go find somebody for the most part. We're doing it because it has benefits in terms of not only how long we live, but how well we live during that time that we're on this ball of mud. So it helps to control several things: your blood pressure, diabetes, if you have high blood sugar, helps you keep a healthy weight, and obviously helps with your blood pressure. And this is not me talking. These are all studies that have been done that have shown that modest amounts of exercise, again, 20 minutes of exercise 4 days a week, has significant effects on all of these parameters of your health. Okay, and I love this one here because we talk about that moderate to intense physical activity is recommended. I'll even back that up and tell me, just give me 20 minutes of exercise 4 days a week. And people say, well, you know, doc, I'm busy. I'm working, or I pick my grandkids up. And I say, well, what would you rather do? Would you rather invest 20 minutes in being healthy, or just take all 24 hours a day and be dead? Because that's basically the choice you're making. Because again, if you can't take 20 minutes a day, invest in your own health, in all likelihood, you're either not going to be around, or you're not going to be around as long as you would like to be to enjoy the other things, which is your grandkids, your retirement, traveling, all of those things that all of us live our whole lives in anticipation of enjoying. If you don't take care of yourself and then you don't invest in yourself, you're not going to be around to enjoy those things. And it's really that simple. And I hope you realize by now, I don't say that in a preaching way. I say it in a way because all of us, myself included, are trying to do those things. Those are the goals we have. But it's one thing to have those goals, it's another to say, okay, well, what am I doing to make sure that I can achieve those goals? And part of that, just like we all know we have to invest for retirement. Most people are smart enough that they know it during their working years. You've got to put some money in the bank, you've got to invest some money, you've got to do different things to have a financial retirement. Well, your health is no different. In fact, your health is much more important than that. You can live and be relatively poor for a long time, but once you're dead, or once you're incapacitated, or once you're living in a nursing home, it doesn't matter how much money you have. Most people know Steve Jobs, who was the head of Apple for forever. Jobs, sorry. If you ever get a chance, go and Google the last thing that he ever said. It'll give me chill bumps still. It's one of the most profound things I've read. Here's a guy who had more money than God. I mean, this guy had more money than he knew what to do with, was wildly successful. And I'll paraphrase it, but he basically said, as he was dying from cancer, he said, all the money in the world doesn't make any difference. He said, I've made more money than a man should ever have a right to make. And he said, I would trade all of it for one more day. And he said, I neglected so many. He said, most people look at me and think that I'm wildly successful. Gosh, wouldn't I love to be Steve Jobs? He said, but I neglected so many things in my life that if I could go back, I would do differently. And so that's the challenge that I make to you now, is take care of yourself, take care of your health, because the older we get, and most of y'all are my age or older, you've come to realize that most of the things that are important in your life are relationship based. They're not based on, my grandfather, who just passed away last year at the age of 93, he said, Tad, when you get to my age, my friends don't care what kind of car I drive or how big my house is or what money I have in the bank. It all becomes your relationships and how you live and how you interact with your friends and your family. So keeping yourself healthy so you can enjoy the things that are really important to you becomes much more key. Okay, again, if you want to go join a gym and you want to do all this stuff, that's great. You know, the Olympic Center over here is fantastic. They do a great job. You don't have to do a lot of fancy things. You don't have to get a personal trainer. If you will go out and you will walk, and again, I keep coming back to this, give me 20 minutes a day, 4 days a week. Go and walk around your neighborhood. You know, go walk with your wife or your husband. You might find out that you like them better than you thought. There's a lot of benefits into doing some of that. Go walk with your daughter or one of your grandkids. You know, and what I tell people is the greatest thing about these little Fitbits that everybody has now is it measures the number of steps you take every day. So unless you're OCD, they're great. Because what I tell people is you don't have to even give me 20 minutes at one time. If you go to Walmart, park at the end of the parking lot and walk into Walmart. If you got to go to the second floor or the third floor, walk up the stairs. God forbid somebody should walk up the stairs. You know, I go to both hospitals, but I think the funniest thing at Mother Francis is if you park in the garage in there and you go in, you have to go up like a little thing. There's an escalator there. Hell, walk up the stairs if you're able to. Some people are not able to, but 90% of us are. I mean, we don't need an escalator to walk up 5 stairs. We've so sort of made our lives easy around here that we've taken away a lot of what people generally do from an exercise standpoint. I mean, none of us my age now worked out in the fields or did anything like that where people got their exercise like they normally did. So you have to find ways to do some type of cardiovascular exercise in this day and age because it's not programmed into the way that we live our lives anymore. Okay, heart healthy diet. Back up from everything we've talked about medications, about all this stuff. If you have chronic diseases, and by chronic diseases I mean there are treatments, but there's no cure. There's no cure for high blood pressure. We can treat it, but there's usually no cure for it. High cholesterol, heart disease, and all this. Food and what you eat and your diet is still the most powerful intervention you can do in any of these disease states. Much more powerful than any medication we do. And this is, again, this is what I tell my patients every day, is that how you live your life and what you do is more important than any medicine I give you. The problem is I can give you a pill, you just take a pill, swallow it, and go on about your business. The interventions you make in terms of your diet and your lifestyle, you have to be conscientious about every day in terms of what you do. So it's a little bit harder, but the benefits are much greater. Okay, and here's what I tell people, and again, I've got 1,000 little sayings that I live my life by, but this is the one I tell people about food. If it comes from a plant, it's probably okay, but if it's made in a plant, it's probably not. There's some exceptions to that. The point is to be conscientious or to live intentionally about what you stick in your mouth. And that is things that generally come from plant-based things, fruits, vegetables, natural things like that, for the most part are good. If you got to make a choice, those are usually good. Something that comes in a package that they can put on the space shuttle and it's still good when they get back home, probably not good. Okay? Things that you can leave out sitting in your pantry and you forget about it for 2 or 3 years and it still looks the same, probably not good. Okay? These are simple concepts that we can all follow. So anything that's preserved, that's packaged, probably has got less nutritional value long term than what you can do with fresh stuff. You know, you go and you buy fresh fruits and vegetables, you notice they spoil after a few days, so you always worry you got to eat them, got to do stuff like that. There's a reason for that, because they're fresh, they don't have preservatives in them, they don't have artificial things in them. Some of this stuff you can buy, and you know, some of the cereal that my 2 teenagers eat, you could leave that stuff in there for years and it'd never look any different, but it's not really food. I mean, it tastes good, but it doesn't really have any nutritional value to it. So there's a trade-off in terms of all of that. All right, people always say, well, are you going to put me on a diet? I said, no, you can eat anything you want to eat, but I'm going to tell you what you want to eat. And so, and this is not an all-inclusive list. I just throw this up here to give you some type of idea of things that people eat that are actually good. And I'm going to simplify it for you in a minute. Doesn't mean you got to eat flaxseed oil. I don't like flaxseed. My wife loves flaxseed, so I'll put that on there to make her happy. So I don't like tofu. There's a lot of choices. You can make choices, and you can take things that you like that have high nutritional value, that make you feel good, that make you live good. I love to eat. I like to eat. But what I realized a few years ago was you can go out and you can eat a Whataburger or a Big Mac and it tastes really good while you're eating, and then you feel lousy afterwards. You know, so you can make a choice to have 5 minutes of feeling really good while you're eating and then feel lousy, or you can make healthy food choices, feel good when you're eating it, but then feel good after you eat it because it makes you feel good. It gives you energy, you continue to have a good weight, your blood pressures are well controlled, and you have the benefits of making healthy lifestyle choices, not just enjoying the 5 minutes while you're actually eating the food. So here's my easier rule to follow. And I got this from any of y'all. There's a guy in town named Bobby Stroop. He runs a workout place called APEC. He trains a lot of high school athletes, college and pro athletes, and Bobby's been a friend of mine for a long time, so I stole this from him. What he tells his athletes is, eat 4 different colored fruits and vegetables every day. Now, do you actually have to eat 4 different colors? He tells them 5. No, but what does he mean by that? He means to make intentional, conscientious choices about eating healthy stuff. So this morning I had an orange, I had a yellow banana. At lunch I had some nuts, and I had, what else did I have? I had a green apple. Now, do I eat vegetarian style? No, I grew up on a cattle ranch. I love to eat red meat, and that's fine, in moderation. But what it means by that is try to make healthy lifestyle choices. And all it does is it makes you focus on being conscientious about what you eat. It takes a little bit of planning. You can't just go around and when you get hungry say, well, you know what, Burger King's the closest thing to me, so let me stop into Burger King. You got to do a little bit of planning about what you do and what you eat. None of us are in danger of starving over a 2-hour period. So when you think you're hungry, you probably got time to go find something healthy. You know, you're not going to pass out and you don't have to run into Grandy's and have, you know, a bucket of fried chicken right away. But you got to train yourself to do that because the default in America is to run through the drive-through and grab the fastest thing you can and to eat on the run and everything else. One of the things that my wife and I discovered, I love to travel. One of the things that we've discovered as we've traveled, especially in Europe and stuff, is there's no low-fat foods over there. They all eat whole foods. They drink whole milk. They eat whole cheeses. They eat meats and stuff like that. And the other thing we notice, you don't see no fat people over there. You see very few obese people over there. In fact, the only time you see obese people is when they're in big tourist groups where they've come from America and Australia. And you say, well, why is that? How can they eat all of these whole foods and all of this different stuff, and yet they're the skinny ones, and we're the ones that live on no fat, you know, low fat, all of this stuff? There's another term that's used in America that you don't see anywhere else in the world, and that is supersize. You'll never see an advertisement for a meal supersized in any part of the world except for America. We are the last country in the world that needs to supersize anything. Because it boils down to the fact that it's important the foods that you eat, but the biggest problem in America is not the foods, even though that's important based on what I've told you today. The biggest problem is the quantity. People eat so many calories, and weight loss, you know, there's all these great books out there, but weight loss is a real simple concept. It's not an easy concept, but it's a simple concept, and that is you got to burn more calories every day than you take in. That's weight loss in a nutshell. The problem is most people eat so much food that they're eating so many calories that there's no way to exercise and burn that many calories every day. So I tell people when they're trying to lose weight, the first thing to do, don't go out and buy all the Slim Fast, don't do all the Atkins. Take whatever you normally eat and push a third of it out of the way. It's impossible not to lose weight if you leave a third of your calories outside of your body. Now at the end of the meal, you can't push it all back in and eat it, but if you'll simply cut down the amount of calories that you eat, you cannot help but to lose weight, I promise you. I've never met anybody that did it honestly and didn't lose weight. So part of it is the nutritional value of the food that you eat, and part of it is the sheer amount of calories that we all take in. And again, it's been shown that it takes about 30 minutes from when you eat something until those signals go to your brain that says, hey, I'm full. But what do most of us do? We pull through the drive-through, man, we're just stuffing it in left and right, left and right. By the time you realize you're full, you say, oh my gosh, I ate too much. The other thing we see when we've traveled around Europe is they don't run through drive-thrus. You know what they do? They sit down at a table with their family and they eat dinner for an hour or an hour and a half. And they eat a little bit and they talk, and they have a little bit of wine and they talk. And so they eat, and when they realize they're full, they haven't stuffed another 400 calories down their gullet before they realize they're full. And so a lot of it has to do with taking a little bit of time, sitting down, enjoying meals as a time to be together, as a social time, and not something that you do while you're running around, you know, going to your next meeting or going to your next social event or running to see the grandkids play Little League or all the things that you want to do. But again, you got to be conscientious about the things that are important to your health. Okay, we're going to end this and then I'll talk as long as you guys want to. Think about where you are. Most of the people in here are in their 60s to their 80s, and I'm just looking at my own patients that are sitting in here. Most people, if they do reasonable things, are going to live into their 90s these days. That's good news. I think that's great news. I'm 49. When I was a teenager and I thought of being 49, I thought, man, you got a foot in the grave at 49. I think very differently about that now. But most of you know, the people I saw in the clinic this morning that are 75, I tell them, you may have as much as 20 years left. Think of yourself 10 or 20 years down the road from where you are right now. Even if you're in your early 80s, you're going to be here for another 10 or 15 years, God willing. What do you want to look like when you're down there? What do you want to look like when you're at that stage in your life? And then what are you willing to do about it now? Because it's not going to happen magically. We all know as we get older, it's harder to stay in shape, it's harder to maintain weight, it's harder to stay healthy. Again, I'm 49. When I was 18, I could drink 2 gallons of milk, eat a steak, play basketball all day, and I couldn't gain weight if I tried. Now, you know, if you look at something wrong, you'll get on the scales and you'll weigh 5 pounds more tomorrow. That's just the way it is. Our metabolism's slow as we age, so you've got to make a more concerted effort about doing it. So have that goal and say, what do I want to be like when I'm 10 or 20 years down the road? And then say, what am I going to do at this point? What changes am I going to make so that I can be where I want to be when I get there? Because again, my goal and my goal for my patients, my goal for you guys and girls, it's not that you live another 10, 20 years, even though I want you to do that, but I want you to live well. I want you to enjoy it. Almost all of my patients that I talk to, they say, you know, I want to live as long as I can, but more than anything, I want to keep my independence. I want to live, and I don't want to live, you know, where I'm a burden to someone else or anything like that. So it's not just about your quantity of life, it's about your quality of life. And again, to go back to what I said at the very beginning, it's about being conscientious and being willing to make the same investments in your health that you've made in your financial future to make sure that you've got a future that's out there that you can enjoy and that you can do the things that you want to do. With that, I'm going to stop, and I'll be happy to answer all the questions that you guys have, but I appreciate your attention. Simple sugars, again, it's a moderation. It's not to say that having any kind of sugar is bad, but simple sugars are the sugars that you see generally in foods and in sweets and stuff like that. What they do is they raise your insulin levels. And when you raise your insulin levels to get rid of all that sugar in your bloodstream, then you sort of start priming your body to put excess insulin into your system. And then you start this whole cycle, this vicious cycle of insulin resistance, which is a pre-diabetic state, which eventually leads to diabetes in a proportion of patients. So it's doing things like that that sort of set you on that thing to being overweight, to insulin resistance, to type 2 diabetes and stuff like that. So if you'll hear the term low glycemic index foods, and that is foods that have complex carbohydrates and things like that as opposed to pure or simple sugars and so forth. What was asked about is what's called TAVR, and this goes to the whole other end of the scale. Instead of living healthy, treating people that have a really bad problem. I'll be real brief on this, and then I'll be happy to talk to you at length about it. Aortic stenosis, or when your aortic valve wears out, has for generations been treated with surgery, with open heart surgery. We've developed a technique. It's been developed around the world and in America for the last several years. Most people are familiar with how we go up through groins with a little catheter to open up blockages in people's hearts. We've now developed the technology and miniaturized an aortic valve where we can do the same thing with that. So people that have aortic stenosis or a worn out or narrowed valve, we can go through their groin, go up and replace their aortic valve without ever making an incision in their chest. In fact, we did our first case. I went to Germany last summer and trained to do this, and Vivek Patel, who's one of the cardiothoracic surgeons that I work with, he and I did the first cases here back in November of last year. It was the first time it had been done in Tyler. So it's offered a treatment for people that before either couldn't have anything done because they were too sick, or they were considered too high risk that they didn't want to undergo open heart surgery. And these were people predominantly in their 80s and even in their early 90s who otherwise were in reasonably good health but had a condition that was going to end their life within the next year or two, but they were too sick to have traditional treatments for it. So it's a less invasive way of treating what's a life-threatening problem in some patients. So yeah, that's a really good question. Let me try to make it probably an oversimplification, but in the interest of time. So over-acidification, let me broaden that a little bit to inflammation in general in the body, and the short answer is yes. Things that are highest, when I say low acidity, are things that cause inflammation in our body. And again, the things from a food product standpoint that do that are things that are typically high in cholesterol, organ meats, processed meats, meats in general, high dairy content food and things like that. They've been shown to promote a kind of a systemic inflammatory response in people's body, and that is one of the big factors that leads to not just heart disease, although heart disease gets the most attention, but all kinds of different things in terms of arthritis, in terms of early onset Alzheimer's, and a lot of this is preliminary research that's gone on. And the reason that's important is they've shown that people that follow predominantly plant-based diets, and again, don't hear that and say, oh gosh, he's telling me I got to be a vegan or a vegetarian. I'm not a vegan or a vegetarian. But it means that people that eat predominantly plant-based diets that don't contain those type things have much later onset of things like that, and there is a big correlation to it, absolutely.
How come they never test for that? I mean,
it's a good question. There's not a good test for it. There's a test called CRP, or C-reactive protein, which is sort of a very broad measure of inflammation in the body. But the issue with doing that is the issue with all tests. And I always tell everybody this: if you're ever going to have a test done, you always got to say, well, what answer are you looking for, and what are you going to do with the results? So if I tell you got high inflammation in your body, there's no pill to lower your inflammation in your body. What I would tell you is you need to try to cut out processed meats. You need to do all these things. Well, guess what? I'm going to tell you that anyway. So it doesn't tell me anything different that I would change how you should be treated and what you should do. Now, if somebody knows they've already got a high inflammatory load in their body, would they be more motivated to make some lifestyle changes? Probably. So in that sense, it's probably good. But most of the therapies that we show that decrease inflammation, that help from that standpoint, are lifestyle changes that are already recommended. Yeah, there is some data out there that says not only is dark chocolate not bad, and we're not talking about milk chocolate, we're talking about dark chocolate, that says that dark chocolate actually it's not bad for you, but it actually does have some benefits in it. And some of this goes back, it's going to all tie back into part of what you were asking earlier, and it has to do with inflammation, with acidity and stuff like that. You know, part of the reason people think that wine is good for you is because of some of the benefits that it has in it in terms of all of this. So all of this sort of ties together. But to answer your question directly, yeah, chocolate in reasonable amounts, dark chocolate specifically, has been shown to have health benefits, absolutely. So the question was congestive heart failure. Is there more than one cause? So for those of you that are not familiar, so congestive heart failure is a big fancy medical term that means your heart's weak. So instead of being an 8-cylinder engine, your heart's a 4 or 6-cylinder engine. Instead of beating like this, it beats like that. And the question is, what causes it? Far and away, the most common cause, especially in the Southeast and in East Texas and in the U.S. in general, is coronary artery disease. Remember I told you your heart's a big pump. It's got 3 big fuel lines that supply blood to it. These are what are called your coronary arteries. You develop blockages in those. They either lead to heart attacks or they restrict blood to your heart so that instead of pumping like this, it weakens. In that case, the treatment is to unblock those arteries, either by surgery, either by stents, either by medication if they're not severe. So that's one cause, and by far and away the predominant cause. Other causes are long-term high blood pressure causes it for the reasons that we talked about. It puts stress on your heart for so long that eventually your heart, for lack of a better term, wears out. It starts to weaken or starts to enlarge. Long-term diabetes does the same thing. It causes your heart to stiffen and get to where it doesn't work as efficiently as it used to. Some people, and this is less common, but a lot of people have heard of friends or family members, they develop a viral infection, not unlike colds and flus that go around this time of the year. And in 1 in 10,000 people, those viruses will migrate from their upper respiratory system into their heart and infect and weaken their heart, and they're left with a heart that's very weak from that standpoint. So to answer your question, there's a variety of things that cause congestive heart failure, and one of the things that we do when somebody gets sent to us with a new diagnosis of congestive heart failure is we try to work through what are the causes, because depending on what the cause is, the treatment's going to be different, obviously. I'll have people that'll come in, and I'm going to give you an extreme example, and then I'm going to kind of come back to what most of us think. But I have people that'll come in and say, Doc, I don't want to be put on medicines for your high blood pressure. I don't want to be put on medicine for my cholesterol, or whatever. But they come in with a bag of supplements, and I say, well, what's all that? Well, this is to help me be healthy. Well, what's in this stuff? Well, I don't know. I don't have any idea. But they said, you know, it'll make me be 6'5", virile as an 18-year-old, and grow my hair down to my rear end. Well, who told you that? Well, it says right here on the bottle it will. Well, right under it, it says this medicine. If you ever hear on the commercials at the very end, real quickly, they'll say this product is not intended to treat, diagnose, or otherwise affect any problem that you might have. What I mean by that is none of that stuff is regulated by the FDA, so they can say what they want. If you take a prescription medicine and they put on there that it does something and it's not been proven that it does, you go to jail for it. That's not to say that a lot of these things don't work. In Western medicine, we don't know everything. So there's some things that are clearly beneficial. Fish oil is a good example of it. There are other examples and so forth. So I'm not saying that some of those things don't work. What I'm saying is educate yourself. The only people we know a lot of supplements benefit are the people that make the supplements because they get rich off of it. So I tell people, be an intelligent consumer, and that is if somebody says, well, you ought to be taking hawthorn root or something else. My grandfather took ginkgo biloba and swore by it. Said it made his memory better. Well, I don't know what his memory would have been like if he didn't take it. It might have been just the same. So do your own research. You know, everybody out here knows how to use the internet today. My mother's in her 70s, and she's on the internet more than anybody I've ever met in their life. And I always say, Google stuff, read stuff. You know, all of y'all are intelligent people. The more you read, and I tell my patients this, the more you read, if I tell you you've got congestive heart failure, well, go Google it, look on the internet. I mean, don't go to a website that's reputable. Go to WebMD, go to the American Heart Association, go somewhere where it may. Don't read what a guy in his backyard in Bangladesh is putting on the internet. I mean, who knows? But if you go to, you know, consider the source. If you go to a reputable source, you'll educate yourself more, and then when you go and you talk to your doctor, you'll ask better questions. I'm getting way away from what you talked about, but it's another big thing that I tell people is educate yourself. I try to help you be as healthy as I can, but ultimately you're responsible for your health. And that means go out and find all the stuff that you can, and that's why the internet is so great now. If you come in and you ask me something that's just outlandish or crazy, I'm just gonna say, well, you know, that's probably, I'm not gonna make fun of you about it, but the more you know, the better questions you can ask, and the more you understand your condition, the better you can be a part of the process to keep yourself healthy. And the more you'll understand what I tell you. That's what I tell my patients when they leave is, I want you to know as much about your disease as I know within reason so that you can take better care of yourself. Calcium coronary screening, let me talk a little bit about that. What they basically do is they put you in a CT scan, and they do a CT scan of your coronary arteries. Again, the arteries that supply blood to your heart, these are the ones that block off, lead to heart attacks. If you already have heart disease, don't have it done, because all it tells you is what's your risk of heart disease. If you already know you have heart disease, it doesn't add any new information. But for somebody that maybe has some high cholesterol, has a family history, and they just want to know, you know, am I at risk for something that I don't have any symptoms of yet? It'll tell you the amount of calcium in your arteries. And you say, well, who cares? The amount of calcium, all blockages have calcium in it. So you can't have a blockage without having calcium in it. They go together like salt and pepper. So we've developed some real nice linear correlations between how much calcium is in your arteries and how much blockage is in your arteries. So if you have a calcium screening done and you have zero or very little calcium in there, we know you have basically no blockages. That's great. High five, it means go and do what you need to do, but you're doing well with what you're doing. If somebody doesn't have any symptoms, but they're kind of in that moderate range, then that may be somebody that we say, listen, you're already doing diet and exercise and your cholesterol's still not optimal. You're probably somebody that we should consider medical therapy to lower your cholesterol even more, because we already know, even though you're not having symptoms, you've got some at least moderate blockage in your heart arteries. Doesn't mean you need to have a stent or surgery or anything, but it means if we can take that process and arrest it where it is or keep it from getting worse, you keep from ever getting to having to come see me in the hospital because you had a heart attack or a stroke or something. So that's where it's beneficial. It's beneficial in screening asymptomatic or people with no symptoms, but risk factors. They want to know, am I at more risk than it looks like from the outside on me?
Right. Now, what if you're on blood pressure medicine and have been for a long time? Would that be
Absolutely, absolutely. Because what you want to know is,
be a good one to ask?
I absolutely think it is. Because if it shows that everything's fine, then it says, hey, everything I'm doing is all I need to be doing. If it shows that you've got some other stuff going on or you have evidence already of blockages, we may want to be more intense about your blood pressure. We may want to try to get your weight down a little bit more. We may want to really emphasize trying to change your diet to try to prevent things from happening down the road. Because again, the earlier you can stop this process, the better you do long term. You can decrease the amount of plaque in your arteries through some medical interventions, and by that you can decrease the calcium some. What I tell people is don't get fixated. If they say your calcium score was 400, if you're not having any symptoms, the goal, you'd have to really do a lot and then check it 2 or 3 years down the road to see any significant change in the calcium. So it's like if I do a cath on somebody, I tell them they got a 30% blockage. They say, well, is there any way to get rid of that? Well, you don't even have to get rid of it. Just don't let it get any worse. And so you want to make the interventions in terms of your lifestyle, your diet, your exercise, your medicines to keep that from ever getting worse. Because if it never gets worse than that, you'll live to be 90 and it won't ever bother you. The same thing if somebody does a calcium score and they say your calcium score is 400, well, you're not having any symptoms, you're doing fine, your heart's strong, you want to keep it from ever getting worse. So there is some data that's shown that you can lower it. It's hard to do, but the biggest thing is keeping it from getting worse. If you can arrest it where it is right there before you have symptoms, you're ahead of the game.